This is the skill administering IV push medications. We will discuss administration through a primary IV line as well as through an intermittent device with extension tubing or IV lock. Complete all medication guidelines, including the 3 checks against the MAR and the 6 rights to medication administration. Complete the 6 essential tasks. Identify the patient using 2 identifiers. Educate the patient about the medication. Check compatibility of the medication with existing intravenous solutions if they are currently infusing. Determine how fast the medication may be administered. This is known as the IV push rate. This can be found in the drug guide. Also determine if the medication needs to be diluted prior to administration. Prepare the medication from a vial or an ampule. Dilute as needed. Don clean procedural gloves. First, we will cover administration through a primary IV line. Scrub the surface of the injection port with alcohol according to facility policy, usually at least 15 seconds. There are typically several ports on the administration tubing set, so you will just select the one that is most appropriate for the medication that you are giving. Typically, it is the closest port to the patient. Insert the medication syringe into the injection port. Pinch or clamp the IV tubing between the IV bag and the port. If needed, depending on your connection device, gently aspirate for blood return. Most of the connection devices that we have currently do not require this. Administer the medication slowly in small increments and according to the IV push rate while observing for reactions to the medication. Unclamp or release the IV tubing. Dispose of supplies safely. When you administer through a primary IV line, the medication will move through the IV line afterwards because of the infusion that is currently being infused. Next, we will administer through an intermittent device with IV extension tubing. Determine the volume of extension tubing that is attached to the access port. This is important because it will help you in knowing how much flush you will need to flush the medication all the way through the tubing. Scrub the surface of the injection port with alcohol according to facility policy. Again, this is usually at least 15 seconds. Insert the flush syringe. Assess patency and aspirate for blood return if required for the connector piece. You will be looking for swelling, inflammation, pain or discomfort when inserting the flush, and also just observing the integrity of the IV. If it is patent and you're good to go, go ahead and scrub the port again. Attach the medication syringe and slowly inject the medication according to the IV push rate. Disconnect the medication syringe. Scrub the injection port and reattach a new IV flush. Once attached, inject the flush at the same rate as you were supposed to for the medication. This is because there is medication still in that extension tubing, so if you were to give this flush too fast, you would then give the rest of the medication too fast. Lock the extension tubing when complete and dispose of supplies safely. For both administration techniques, observe the patient for reactions to the medications and complete the ending 4 tasks.